Let's look at some positions for
Oh,
breastfeeding.
okay. Position, which is how you hold the baby, is really important to affect correct attachment. Roger's looking like he needs a bath, actually. I don't know, the baby bath session. So what we need to do is face the baby sort of so his or her back is straight, and that we tuck the arm under. Sometimes it can go around mum's waist, or sometimes it can be just straight underneath. So we're wanting mum to have really good posture and be relaxed. So dropping the shoulders is really important for mum.
That's really, actually, just being relaxed is important in terms of milk flow.
That's right.
If you're stressed...
Yeah. It can inhibit the letdown, which is the actually ejection of the breast milk. So being relaxed is important, and being comfortable. So you don't want to be, you know, just look after yourself in terms of that, because you don't know how long a breastfeed might last. You know, you could be here for 10 minutes or 20 minutes or half an hour. So be sure you're comfortable, and having the baby comfortable, and often, you know, having the baby, having mum's hand between their shoulder blades pushes their chest out, and that we're wanting our baby's chest to be at our chest, facing our chest. We want baby's chin to be at our breast. So chest to chest, chin to breast. So if you think about that for a minute. So that's really important, and we're not, you know, we're bringing baby to our chest, to our breast. We're not leaning over and bringing our breast.
That's so important with the back and the shoulders.
That's right. We're not bringing our breast to the baby to try and find its mouth. We're teasing baby's mouth open with the nipple, so you can hold the nipple with your free hand and then guide your baby's mouth onto the nipple. It can be uncomfortable those first, you know, 10 to 12 or 20 sucks, but you know, depending, you know, how hungry the baby is, and some babies have an incredibly strong suction, other babies don't. But generally speaking, we're not after the breastfeed to be painful or sustain discomfort. So if it is, that means that there's likely to be some damage happening to the nipple, and you can tell that when baby comes off, that if there's any blanching of the nipple, or if the nipple has squashed to one side, that you will understand, well, that's because the baby wasn't attached properly. And if that's the feeling I had with that experience, with that feed, then I know that that's not what I'm looking for. That's not what's normal. So to keep changing and getting it right.
There's a couple of different positions in breastfeeding.
Yeah, there are. Like, and it depends. If some mums who've had a caesarean find it a bit uncomfortable for those several weeks after the birth, so they might like to use a cushion or a pillow underneath to protect their scar. There's the football hole, which can be demonstrated, because I think Roger's, you know, built just for the football hole, really, which means that the baby can be facing here with the legs going out the side, and even lying down to breastfeed is really great. It's a great way for mum and baby to get a rest at the, you know, or mum to get a rest while baby's feeding. So, and that, you know, basically it's the same principle, that you can be lying down with baby, you bring baby to you, that, you know, you don't have any blankets or doonas or pillows in the way of the baby, and babies feed beautifully.